In this video, we will be learning about the different parts of an ulcer and the types of ulcers. So an ulcer has a margin, an edge, a floor and a base. The margin of an ulcer is the junction between the normal epithelium and the ulcer. And the edge is what connects the margin to the floor. And the floor of an ulcer is the exposed surface of the ulcer, and the base of an ulcer is on which the ulcer rests. And the base of an ulcer could be fascia, muscles, tendon, or even bone, depending upon the depth of the ulcer. So to understand the parts of an ulcer better, let us imagine an ulcer as a room with 4 walls, a ceiling and a floor. The different parts of an ulcer can be compared to the different elements of the room. The margin of the ulcer is the line where the ceiling meets the side walls. And the edge of the ulcer can be compared to the side walls of the room. The floor of the ulcer is the actual floor of the room, and the base of the ulcer can be compared to the foundation, the soil and the cement beneath the floor. So now imagine removing the ceiling of the room and looking down from above. So now what you see is exactly how an ulcer appears clinically. So we have 5 types of ulcers based on the type of the edge. So if an ulcer has a sloping edge, then it is either a traumatic ulcer which is healing or a venous ulcer. And an ulcer with an undermined edge will be mostly because of tuberculosis. This is because the disease destroys the subcutaneous tissue and the deeper structures more than the skin. And this leads to the skin overhanging the ulcer. Punched out edges, that is where the edge drops down at right angle from the skin, is a feature of trophic ulcers and syphilitic gummatous ulcers. And everted edges, as shown in the diagram, they are a feature of malignant ulcers. So a squamous cell carcinoma or an ulcerated adenocarcinoma. Finally, raised and pearly white beaded edges are a feature of rodent ulcer or basal cell carcinoma. And to remember the different types of edges, we have the mnemonic SUPER, that is super. That is sloping, undermined, punched out, everted, raised and pearly white beaded. And we can also remember rodent ulcer as an example for raised and pearly white beaded edged ulcer because of the letter R.